Okay, so here we are in the AIS imaging suite. And depending on which practice management software you have, you may have come to this page through a different bridge or link directly through your PMS, or you may come in here directly if this is your standalone imaging suite. But a couple things to note here on the screen. I have two patients currently in my database, a test patient and a dual scan patient. If you want to add a new patient, clicking Add New will allow you to input new patient information. Okay. Otherwise, we can search by name on the top if we're looking through a long list of patients and looking for one specific one. But let's go ahead and dive into our test patient here by double clicking. And here we'll see this is the patient's chart, if you will, our imaging chart. And I have a couple things that I've pre-imported for us here. We have some 2D images. They can either be x-rays, like in this case, a panoramic image. We even have some clinical photos. If you wanted to import and therefore store your patient's imaging in a HIPAA compliant manner, we can simply go up to the top bar here, import file, and find the file that you're looking for. Okay. I also have some 3D files. So same thing. If you have intraoral scanners or desktop scanners and you have patient-specific 3D models, maybe it's you scan their denture, or you have an intraoral scan of their mouth, or a provisional bridge, or what have you, you can store that in their imaging suite for safekeeping. And then you'll always know where it is rather than trying to navigate through your computer's folders. Also, obviously, we have CBCTs. So in this case, we have a CBCT here. And if we double click on this, it will open our imaging software. And so we'll get to that here in a bit. First, let's pretend like this patient does not have a CBCT and we want to set up the machine to take it. So if we're on your acquisition computer right now, we go to the top, we have a couple options. You see the green light buttons here means that we can start to do these options from this computer. We have the panoramic, a Ceph, and the CBCT. Let's start with the panoramic. If you click on the panoramic screen, this gives us the panoramic acquisition options. Pretty simple stuff. For the most part, you're going to keep it in a standard panoramic and choose child or adult, small, medium, or large. And all that's going to do is change the amount of radiation for better image viewing. But generally, medium adult is going to get you what you need. You can also do some bite wings. So if you have maybe a younger patient or somebody with large tori, or it's uncomfortable to get a bite wing, or they have trismus or some other reason, we can come in here and do a single side, choose the side, or we can do bilateral and choose both. Okay, so we do have some extraoral bite wing imaging capabilities. We can just image the sinus, which will focus the focal trowel higher up on the patient as well. And if you're a practice that's dealing with a lot of TMD, you can image the TMJs as well through this panoramic screen. If we go back to the panoramic image, we also have half panos, so you can choose right or left. We can just do the anterior portion. We can do a low dose pano as well. Okay, so those are all of our options for panoramic acquisition. I'm going to go ahead and exit this, and we're going to go to our CBCT. So let's pretend like we want to do a CBCT acquisition of this patient. Okay, so CBCT acquisition looks a little bit different. Obviously, it's a three-dimensional X-ray. So we have a couple different options here. Your most typical is probably going to be a full dentition scan on an adult. If you'd like to do extended volumes, simply click extended volumes, and this will be more appropriate for people who are doing larger implant cases or maybe wisdom teeth surgery or anything involving the sinus or TMJ. These extended volumes will give you the maximum amount of field of view for your scanner. We also have some smaller field of view cases here. Currently it's selected on mandibular, and we can choose either posterior quadrants, the middle sextant, or the anterior sextant, and the same thing on the right and the left. So this might be really nice for endodontics because our smaller field of view is going to give us an even more accurate and smaller voxel. It might be great to do a single quadrant scan on a post-op implant surgery where we don't need to get the full scan again, but we just want to focus on that one quadrant or area of the mouth where we did our surgery. We also have single jaw. In the small field of view, we can also obviously choose maxillary teeth, and we get the same options for the maxilla. Single jaw is going to be maxilla or mandible. And what's important to note in the single jaw acquisition panel here is that when we choose the mandible, we can also have these options kind of come up. dental impression, and plaster model. We'll end up using plaster model more than the other two, but if you had a patient's model, let's say it's a denture or a stone model or something that you wanted to digitize via your x-ray machine, this is where you would come. Single jaw, mandible, plaster model. Okay. If you're doing TMJ, similar, we're going to go to a TMJ segment and we choose the right or the left for our imaging on that image. And then last but not least, sinus is going to give us a much higher focal trial to make sure that we get all the way to the orbital floor if we're doing any sort of sinus surgery. On the left here, we have some options. The metal artifact filter is a software add-on that will help reduce scatter. So always recommend having that clicked on. And if you're doing test mode, let's say you're training with your team, or you want to have the machine spin around a patient and make sure it's not going to bump into them, you could toggle on the test mode there. But for all intents and purposes, we're going to do a full dentition scan, and we're going to have our metal artifact filter on, and we're going to go ahead and select the exam and then press the ready button on the machine. So let's go ahead and take a look for more patient positioning.